Hey guys, welcome back. I'm Kenia here at the St. John Clark Pain Treatment Center, and I wanted to share with you a little bit more about neurosomatic therapy and some of the more unique things that we treat here at the clinic. Now, neurosomatic therapy is a form of manual therapy where we focus on identifying and treating the true source of your pain. We do that using an integrative approach where we take not just your current symptoms, but your past history, any x-rays, MRIs, anything that you can tell us about your condition, coupled together with a postural analysis. Now, this allows us to get 84 measurements on what your body's doing in both standing and laying down positions, as well as measurements of your cranial bones and your first and second vertebrae. Doing this paints a clear picture of any postural distortions that you may be dealing with, like tilts, rotations, compressions, curvatures, things like that. And together with an extensive interview, it can help pinpoint the source of your pain. Now, what do we treat here at the clinic? Of course, we deal with common complaints like low back pain, knee pain, shoulder pain, things like limited range of motion, carpal tunnel, thoracic outlet syndrome, and even migraines. But we also treat some very unique things here. Because we take measurements of your cranial bones, we can identify when there's a distortion in those bones. Now, a distortion in cranial bones can lead to a compression of the structure of the brain. Because the connective tissue surrounds the brain and attaches to these bones, if there's a distortion, it can compress the brain, leading to a reduction in blood flow and ultimately a reduction in function. So if you're dealing with things like memory loss, brain fog, irritability, things like that, then there may be a distortion in these cranial bones impeding proper function. In children, if they've had a traumatic birth where they had to use forceps or a suction to get the baby out, that can really distort these bones and can show up as developmental delays in children. If you've incurred an injury where you had to get stitches or maybe broke the orbit of your eye, we can help with decompressing these bones and restoring function and symmetry. If you've broken your nose and are dealing with a deviated septum, this can lead to improper breathing patterns. So we do something called nasal decompression here, where we go in through the nostril and decompress these bones here. It's really great too for if you've broken the orbit of the eye and are dealing with just compression and pain on the eye socket there. Speaking of the eyes, that's another unique thing that we treat here, is the muscles that move the eyes. So if you're dealing with watery eyes, dry eyes, blurred vision, things like that, if you have to focus at a computer for a long periods of time, or if you have a job where you constantly have to shift your gaze, or maybe you wear bifocals and there's a lot of strain on the muscles of the eyes, we can help with treating those muscles and restoring function to those muscles. And we also deal with things like TMJ dysfunction. Now, TMJ dysfunction can be clicking of the jaw, popping of the jaw. It can deal with grinding of the teeth and clenching. It can be very painful and it can lead to migraines and headaches. And so we treat the muscles on the outside of the mouth, the muscles of mastication, which are your chewing muscles. We also deal intraorally with these muscles, where we deal with the muscles that move the jaw, and so super effective for people that are having TMJ dysfunction. We treat the muscles of the floor of the mouth and also the tongue, which is a major muscle of the mouth and can be very effective in releasing that tension in the tongue and allowing for less snoring, better use of your tongue if you're a singer, just really, really exciting stuff. We can also deal with things like thyroid dysfunction. If there's a lot of pressure in the front of the neck, if you're dealing with a straight cervical spine and there's this constant compression in here on the front of the neck, treating the anterior neck musculature can really open up this area and allow for proper function of the thyroid. We can also treat the organs and help resolve some digestive issues. So if you're dealing with bloating after you're eating, constipation, diarrhea, those are things that you wouldn't normally think that your manual therapist would be able to treat. But we have an excellent protocol for dealing with those dysfunctions, and we get great results for people that are dealing with not just digestive difficulties, but issues with their pancreas, issues with the liver, kidney, bladder. For women that are dealing with painful menstruations, treatment of the uterus and the ovaries can be really effective in dealing with those things. Guys, this is just a sliver of what we can do here that's outside of the traditional manual therapy work. We're so excited to help you and to give you hope to know that there's something that can be done for you. If you've seen us in the past deal with these muscular conditions, but you're dealing with some of these other things I mentioned, don't hesitate to give us a call. We'd love to see you and treat you for these things as well. There's hope, there's relief out here for you. Come seek it out, come find it, and we're excited to do it with you.